Hi everyone, this week's teaching assistant is Lucky. Say hello, Lucky. We've probably seen Lucky before, but I've lost count of which animals I've showed you and which ones I haven't. Alright, so this week we are covering the fourth component of evidence-based practice, which is research evidence. So today we're going to talk about the research question, and next week we'll discuss the various methodologies and how to critically assess research. So, step to assess and apply research. The first step is to formulate a research question and link that to research methodology. Then you search for evidence to answer your research question. And then once you have a pile of evidence, you need to critically appraise it. Some of it is not going to be quality research, unfortunately, especially with predatory publications on the rise. What we have now is a bunch of research that sneaks in there that is just, it's terrible. It's not peer-reviewed. It doesn't make a lot of sense and is quite flawed. So we have to critically appraise anything we find to actually make sure it's quality research. And lastly, you're going to assess how what you have found and whether or not even you're going to use it in your practice. So let's start from that first step, the formulation of a research question. You really need to think about what you want to know, and you want to make sure that your question is clear and it's not too simple or too complex. You want to avoid yes or no answers typically, and you also want to avoid number answers. For instance, how many people experience depression in Canada. That's, you can find an approximate answer in the research literature, but it's not really helpful to addressing the needs of people with depression, is it? So one of the things that can help guide you in developing a research question is what's known as PICO, P-I-C-O. It stands for population/patient or problem, then the interest, intervention, or exposure. C is for comparison or control, and O is the outcome. So with P, this is the part of the question where you would identify who or what is the main interest of the question. So let's continue with our example of Canadians who experience depression. That can be our population of interest, and the problem would be depression. And then for I, we look at, we identify what we're interested in learning or what intervention or therapy we wish to consider. So perhaps we could consider cognitive behavioral therapy. And then for C, this is the part of the question, you would compare the group of interest to a comparison group. And with the O, this is where you would identify an outcome that you need. So continuing with depression, we could say, is cognitive behavioral therapy more effective for Canadians with depression than, for instance, dialectical behavioral therapy? So our comparison group there is a different type of therapy, and the outcome that we're looking for is a decrease in the depressive symptomology. So looking at another example, for instance, does one-on-one tutoring help youth involved with the child welfare system improve their academic functioning? So the population here is youth involved with child welfare, and the intervention that we're considering here is the one-on-one tutoring. The comparison group is the youth who are not receiving one-on-one tutoring, and the outcome of interest is that academic functioning. So as you can see, these research questions are clear, focused, they're not too simple, and they're not too complex. The important thing to remember is that your research questions should address something of importance. It should be something that's interesting to you or to the population with which you work. And it should also be a non-biased research question. So, for instance, we can't ask something like, is the University of Windsor the best university in Ontario? That is a biased question, and it's also a bit too simple. So avoid those kind of questions. With the clarity of the question, you want to make sure it's not vague or leading the way that my University of Windsor question was. So an example of an unclear question would be, how are drugs harmful on a developing fetus? So already we're making a judgment here that drugs are harmful. And drugs itself is just a very, very vague term. It could mean pretty much anything. A more clear research question would be, how does occasional use of marijuana impact the developing fetus? We also have to consider the focus of the question to make sure it's not too broad or too narrow. So an unfocused research question would be, what are good intervention programs for at-risk youth? That's just way too broad. Intervention programs for what specifically, right? So what is a more focused research question would be, is the intervention program shown to have good outcomes when working with homeless youth? So we specified now a particular aspect of at-risk youth experience, and that is homelessness. We also need to consider the complexity of the question. So we don't want it to be too simple, but we also don't want it too complex, because then it could be very difficult to answer. So something that's too simple are, what are the effects of spanking on the child? A more complex question would be, how does being spanked as a child correlate with future substance use? So now we have drawn a possible link between childhood experience and adult behavior. And it's a lot more focused and detailed than the very simple, just what are the general effects of spanking on a child. So let's look at these questions here and assess them on your own. Are these research questions clear, focused, and not too simple or complex? And if not, how can you fix them? So do youth in group homes like staff who work with them? Can a mother parent properly if she has a substance use problem? How many kids are in foster care in my city? Does this program have strong research supporting it? I'll give you a hint. 3 out of these 4 questions are terrible, and the last one is only relatively terrible, but they all need to be fixed. So how would you fix them? The importance of research questions is not just so you can focus your attention to exactly what the problem or issue is, but it also determines what methodology you should be considering and the knowledge claim that can be made from that methodology. So not every type of research method can make any kind of knowledge claim. For instance, if you want to know about the occurrence of something, like how often does something happen, like what is the rate of placement for Indigenous versus non-Indigenous children and youth, or what is the rate of high school completion for youth living in out-of-home care, we would consider longitudinal studies. Those are the best for this type of research question. And second best are cross-sectional studies. And the reason for this is that longitudinal studies, so the studies that follow participants over a long period of time, can help us determine patterns, and connections between relationships become clear because we collect a variety of variables, not just whether or not the youth is in care or not, or whether they're Aboriginal or not, but we can also look at other things like their academic success in order to determine the relationships over time between multiple factors. On the other hand, cross-sectional studies occur at just one point in time, but they can be used as an estimate to the wider population, and many factors can be assessed. The limitation to cross-sectional studies is that they are just a snapshot in time, so they can't tell you anything about cause and effect. They're only able to give you correlations, right? And correlation is not causation. Longitudinal studies, on the other hand, also have limitations. They're very, very expensive to do, and you need a very large sample size because as time goes on, participants drop out. So while you might start with 200 youth, after 10 years, you might only be able to find 20 of those youth. So each one of these methodologies has its limitations. So as you're looking at research, make sure you remember longitudinal study, better at answering occurrence questions versus cross-sectional if the sample size is efficient and you haven't lost most of the participants by the end of the study. If you want to know about an association, so what factors best predict desirable or undesirable outcomes, like for instance, what factors predict turnover among child welfare workers, or what child case or caregiver factors predict out-of-home placement, you should consider firstly correlational or cross-sectional studies, then systematic review studies, followed by randomized control trials, and lastly, non-randomized studies, such as control and intervention studies or waitlist studies. These are also known as quasi-experimental studies. So the correlational study, as I mentioned, can illustrate the relationship or association between many factors. So just because it occurs just at one point in time, it can still give us both the strength and the direction of the relationship. So it can tell us, oh, people's salary, the higher it is, the more likely they are to stay. And notice my language here, it's more likely. I'm not saying that the salary is causing them to stay longer. It could just as easily be that they're sticking around longer, so they have time to build up their promotions and raises. You have to be very careful with your language. I'm not making any cause and effect statements, and neither should studies that use only correlational methodology. Systematic review, on the other hand, what it does is it combines several studies and summarizes them in a standardized way. This is important because one study can't consider all of the factors that might be important. So when you consider many studies, you get a better look at the overall picture. The problem is that systematic reviews can be very hard to find, especially for very specific research questions. If you want to know about people's experiences, such as what can I learn from clients or programs with the experiences of others, like for instance, you might ask, how do youth living in out-of-home care feel about their caregivers? You want to look at qualitative research most frequently. So that could be interviews or focus groups with the population of interest, or a systematic review, or a correlational study. That would be the least effective at answering your research question. That's what these stars in the slides represent. So the reason for that is that the qualitative methods provide rich and detailed information so that you can better understand people's experiences from their own perspective, in their own words. And then again, the systematic review can combine several studies, including qualitative ones. So systematic reviews are not limited just to quantitative studies. However, what you always have to remember is that the experiences being described are for that sample of participants only, and they can't be generalized to other participants. And then lastly, we've got effectiveness studies. So what does this treatment policy or program work? Is it effective? And a sample research question could be, what's the effectiveness of substance abuse treatment for youth with alcohol problems? Or what is the effectiveness of treatment foster care for youth? Now, with effectiveness studies, the gold standard are things like systematic review and meta-analysis, followed by randomized control trials, the non-randomized, aka quasi-experimental studies, then correlational, and later anything else. So the systematic reviews and meta-analysis take into account several studies, but the meta-analysis goes a step further and actually considers what the strength of an intervention is, how big an effect it is actually having. So it quantifies the difference it makes according to a wide range of studies. And when you have a control and intervention group, you're able to actually show the effectiveness and the intervention, and you're actually able to say that yes, it's the intervention that has actually caused improvement in the symptoms we are considering. The problem with most of these that have the lots of stars is that they're very difficult to find. Not many randomized control trials are conducted in social work. It's very expensive and also very difficult to have a control group with the very vulnerable populations that we work with. It just would not be ethical. So we have to depend on non-randomized studies and correlations most of the time. All right, so let's go back a step then and consider step 1, how to formulate a research question. So think about your placement. What do you want to know? Do you have any population or intervention that's being used within your agency that you want to know more about? Consider a research question that you could answer and use to guide your search of the research literature. And then search for evidence. So there's the Campbell collaboration, which can give you a summary of all the systematic reviews or meta-analyses done on certain topics. And also we've got our lovely library system at the University of Windsor, as well as our social work librarian, Sharon Monroe. She can definitely help you with the search for the evidence. So for the final assignment for this semester, what you're going to be doing is you're going to be applying the PICO method to a topic that you would like to focus on for your fact sheet. So stop the video here and write down a potential question that covers both the population, the interest, the comparison, and the outcome. Make sure that your question is clear and concise. And what could from this question be some keywords that you could use for your search? For instance, if my research question was, what factors are associated with positive or negative educational outcomes for youth living in out-of-home care, potential keywords I might use could be educational outcomes or academics. And then for the population, I could say youth or adolescents. And this is the asterisk at the end of the word expands the word. So I could search either adolescents or adolescents. So all of those terms will be included in the search. And then I also want to cover, exactly what population I'm talking about. So I'm talking about child welfare, child protection, and youth who are out of home care or placement. You can use these links here to enter in your research terms. There are online guides to help you do the search. And again, our lovely librarian, Sharon Monroe, is found at the Letty Library 4 out of 5 days of the week. The 5th day, Wednesdays, I believe, she is on at the Social Work Building. And she can also do Zoom sessions with you as well if you can't come to campus, and she can help you with this search. Basic steps for a database search are 1, log on to the Letty Library, find a database you're comfortable using, input your keywords, and search. Then look at the results from the search. Sometimes you might find 10,000 articles that come back, but in general, just the first few are going to be the most relevant. Sometimes you need to adjust your search. If only 1 or 2 articles are coming up, you need to widen things up a little bit. And you also need to make sure that the studies you find match the methodology you're looking for. And again, the methodology you're looking for is going to be impacted by the type of research question you have. So make sure you keep track of what keywords you are using in your search, so that when we practice together on Thursday, you're not repeating ineffective searches. So in summary, you need to develop a research question using the PICO criteria, and then try searching for the answer to that question with a database search.